and I wanted to share with the DMCites that DMC was an institution which provided two epidemiological studies. First study was conducted in a local population near Ludhiana, and second study was a Pan-Punjab study. Based on observations of the Pan-Punjab study, epidemiological study, the state government noticed that hepatitis C is a major health issue in Punjab, and I think this did influence them in coming up with this free medication and free treatment kind of policy with this. I mean, I just wanted to highlight that the being in DMC is very important. And furthermore, hepatitis C is a disease which has very diverse presentations. As we heard in the morning, that there are many barriers to treatment, because most of the patients of hepatitis C are either asymptomatic, and it's very difficult to convince a person who's got no symptom to come forward for testing. As Dr. Harman was showing, that they want to test all people visiting hospitals, but practically, if we see realistically, if we see that can we really check hepatitis C, or can we really come to know the prevalence of hepatitis C in the state? I mean, it may not be true, because then people who got symptoms, they visit hospitals, while more than half of the patients of hepatitis C, they remain asymptomatic till very late stage. So this is a major barrier in controlling hepatitis C. The other thing which has emerged is that now we are seeing more and more treatments of hepatitis C, and once there is elimination of the virus, or once there is eradication of the virus, at times what can happen is the doctor can say, okay, your virus is gone, now you are free. Or patient can assume that his virus is gone and he is absolutely been cured. No doubt, patient has been cured of the virus. But what remains inside the body is that if a person only has reached a stage of significant fibrosis, F3 or cirrhosis, there is a very substantial risk of developing liver cancer in such patients. So there is a bit of snag, and which, if there is a lack of communication between patient and provider, patient may feel that he is all right, but risk of such a major illness like cancer remains. So we have to be alert on this, that any patient who's got a significant fibrosis, we must highlight that your virus is gone, but liver fibrosis is there, which needs surveillance. And that surveillance was very well highlighted by Dr. Sinha in his lecture. So in this CME, I just wanted to share these 2 points. That one, that we should think of focusing on screening of asymptomatic people, and we should not forget that patients who got significant fibrosis, they need a lifelong surveillance. And I'm sure the goal set by WHO of elimination of 2030 can be achieved if public and private sectors join hands. Thank you. Thank you.